Hey, good morning, everybody, and welcome to the city's COVID briefing. And we have lots to go over today. As an overview of some of our topics, we're going to be looking at, of course, our standard sort of where we are with respect to COVID positivity. And we're going to spend a little bit of time talking about getting to yellow. And that, of course, means transitioning into the next phase of the public health regulations. We're also going to have some guest speakers to touch on a couple of areas. We're going to be joined by our city councilor, Lan Senna, to talk a little bit about vaccines. We're also going to be joined by Dr. Sandoval, the chief medical officer from Lovelace. And we are also going to touch on some of our funding with respect to different nonprofits in the community, and we'll be joined by Mariah Harrison, who does a nonprofit and philanthropy work here out of the city. So lots to go over. So I'm going to go ahead and dive right in with our traditional update in terms of where we're at on a couple areas with respect to COVID. And want to, I think, initially just say that, I think Burqueños have done a good job, and so has our public health department and everyone at the city and everyone else involved in this, and the hospitals, in terms of getting our numbers down. Our numbers are much, much improved. And so after falling back in last fall, we really are in a much better position now. And so let's take a look at exactly where we're at here. So if we go over and look at our comparison between us and other cities around us, you see a couple of things that jump out here. I think the biggest one, of course, is the number of positive cases. And again, these are per capita, so per 100,000. And you see us near the top. Austin actually has a little bit lower rate, good for them. But if you see us, we're now back in the leadership position, again, having a lower number of cases per capita compared to Denver, although they're pretty close to us, but in a much healthier position than Tucson and Phoenix. And you can see, these double digit in terms of 10,000, 11,000, 13,000 for Phoenix, Salt Lake, and El Paso, just much higher positivity rates there, even Los Angeles and Oklahoma City. So we're grateful and appreciative that we're back in a position we've been in pretty much the whole pandemic, with a minor exception, which is that we've just seen fewer positive cases. And so, that can mean a lot of things, but in general, it's a positive thing to see. Now, in terms of total tested, we are seeing that we're now kind of in the middle of the pack as a percentage of population that's being tested. And this continues to be a very key, important part of our strategy to get through the pandemic. We absolutely want to encourage everyone to get tested. First and foremost for your health and the health of your friends, family, coworkers, so that if you are positive, that you follow those rules around quarantining so that we reduce spread. Also, so that you're put in touch with the appropriate medical providers just in case your symptoms get worse. And again, if you're asymptomatic, so you're not spreading it without knowing it. So we really want everyone to get tested. And again, when in doubt, get tested. That also helps us, just in terms of general data and knowledge of where the population's at. So I think the best positive news we see is down at the bottom, our positivity rate tracking. We see our positivity rate continue to drop, and there's a little bit of a difference. This is like a 7-day rolling average. We'll talk about the state rating, which matters a lot more for us. But on a comparative basis, we have to use kind of the national standard, which is a 7-day total. So anyway, the point is we are in a great position. We are with Denver at the top of a very, very important list, which is the percentage of new tests that are positive, or positivity rate. And you see us, roughly around 5%. And, these other cities, if folks haven't seen what's happening around the country, unfortunately, things are very bad with respect to COVID in other parts of the country. And you see, whether it's Tucson at 15 or Phoenix at 15, and these cities in double digits, Salt Lake, Oklahoma City, and LA, it's just, there is a very different situation. than there is here when it comes to the percentage of positive tests. And so that number is a reflection, I think, of us doing all we can to reduce the spread and also get tested, right? That's the other part of that equation. So with that, let's talk a little bit about where we're at with respect to the gating criteria for the state of New Mexico. So again, we go from sort of a regional picture to where we're at in terms of our state. And what we see here is we believe we're getting close to yellow. And I'll sort of explain this a little bit because I know there's a lot of excitement around yellow, but also a lot of questions and lots of work to do, both to stay in yellow and see where we go from there. So let's remember there are two criteria. There's the positive cases per 100,000. And here you see in this column, that's the last official number from DOH. Well, as of, that's the last, that's 4 weeks ago, basically, or in this case, it was 3 weeks ago. And then you see last week, which is this column, this middle column here. And then we do track this every couple of days. Now it's unofficial numbers. These are sort of like election results. These are unofficial forecasted numbers, but they've been pretty close so far. And then so that's where we believe in the metro area or the county where we're at here in terms of Albuquerque. So you see us still being extremely far from the positive case gating criteria, right? Coming in at we think about 30 cases. In the criteria being 8. So we got a long way to go on that one, no doubt. Now on positivity rate, we see the official numbers, we were at 10.5, then we dropped to 6.7. We think right now we're around 4.7. Now that is, as you can see on the date up there, that's as of today. Now the state measures this on Wednesdays every 2 weeks. So not tomorrow, but the Wednesday after that, we'll know kind of the official number. And that is the official number that is used on whether or not we can go to yellow or not. So what this number indicates, I think, is a couple of things. One is our forecast looks good. The other thing, though, is that it's not a foregone conclusion. There's still, on that 14-day average, right? There is still half of that 14 days left to go. So just in the very short term, this is yet another reminder of how we need to continue doing all the things we're doing with respect to following the public health order and getting tested. Now, if we are preparing as a city to understand what the world looks like in Albuquerque if we move to yellow. So I'm going to speak a little bit about that, but I just want to let everyone know, again, it is not for sure that we will be able to go to yellow next week, but we're optimistic and the forecast looks good. So maybe a better analogy here is the weather. So what this means if we can go to yellow is the biggest thing by far is just that restaurants can open 25% capacity inside. That is by far the biggest change. There's actually not much of a change in the other criteria other than the capacity kind of goes up a little bit for lots of different businesses. And even lots of the different activities that the city does, whether it's, drive-in activities or even, capacities for houses of worship, outdoor capacity does go up to 75%, which is great for outdoor dining. And so there are, again, particularly in the restaurant area, some real increases. For the others, it's really just about increasing the volume a little bit. Like in retail, you go from 25% to 33%. So a measured increase other than, again, I think a very meaningful increase. So we all need to do what we can to push us over sort of that line to get to yellow. So just want to encourage people, again, to follow the public health order, masks, distancing, and also to get tested. Now, as we go, if we think about going into yellow, we'll certainly on Thursday, we'll have an update if we're going to yellow from the city's perspective. But I want to remind folks, there are plenty of counties that have gone to yellow and then slipped back, or at least a few counties. So again, you're only in that phase for 2 weeks until the next measure, and you may slip back. So again, that vigilance is really important when it comes to the public health order and to testing. So With that, let's do a couple of things. One, oh, I do want to mention is that at the city level, things like our community centers, which right now are, of course, taking care of childcare and so forth, the capacities really go up. So whether it's City Hall or those different kinds of in-person activities or the zoo or golf courses, all of these things, we'll update you with what that means as we go to yellow. But the short story is we get a little bit of capacity increase. That's basically the situation there. All right. Now, we also, want to be really focused on green, and green means getting the volume of cases down. As you can see on this chart, we're very far from green. So we would expect yellow to be the best we can do for quite some time. Now, let me transition a little bit over to vaccines. And we want to share a couple of things. Number one, our approach has always been, if you're offered the shot, take the shot. And so we do know that there's a much more limited supply currently in the system in New Mexico. So this has been widely shared at the state and other levels. So, unfortunately, there just aren't as many vaccines out there as there was before. But hopefully, I know the federal government's working to try and really get a lot more out. But I think for a couple of weeks, there's just not as many vaccines in the state right now. So progress has certainly slowed a little bit. But we can share a couple of items on this. Number one, let's just look at our numbers with respect to that in Albuquerque area. And so we have right here our sort of county level data, but you can see that about 15% of individuals in the county who've signed up have gotten the vaccination, and the statewide figure is about 10%. So we are ahead of the statewide average. We want to be obviously as far as we can, but I do think it's been a credit to at least the providers to really get this out, and one of those is the city. So I'll touch on some specifics with the work that the city's doing on this. And I also, of course, want to remind everyone the various definitions and these kinds of things are all set by the DOH and the algorithm and so forth. But where the city is helping out is essentially providing these points of distribution. And so setting up, again, that apparatus to deliver those vaccines. And so we've held 11 points of distribution so far, and we've partnered with lots of folks, but primarily, of course, the Department of Health, but also Lovelace, Walgreens, Optum, Acute Care, and others. And the city apparatus has been able to do about 10,000 vaccines to the public, again, based on the DOH phases. We do have 11 more proposed. And as a reminder, the City of Albuquerque's Emergency Operations Center actually has been training for this for years. And in fact, not last December, but the December before the pandemic hit, we had a full-scale training exercise on how to vaccinate the public. So the city does have the capacity to vaccinate many more, thousands more daily, but those vaccinations just aren't there right now. But we stand ready to be able to get those out the door when they are. I do want to mention also, of course, there's lots of channels in which the vaccine's being offered. Again, some are coordinated, some are not. I continue to hear all the stories about, these codes floating around on the internet. I hear, the Walmart phone calls that, Walmart's just calling people and giving shots. So, hey, I mean, getting shots in arms is a good thing, but I also just want to let folks know that we hear the same complaints that everyone else does. And part of it is some of these systems are coordinated and some are not. Some are just, national corporations trying to get shots in arms. So we are trying to help in the areas we're involved in, and that does include senior affairs. And so now with our senior population, our city senior affairs department is helping folks who are 60 and older register. And I know this has been a challenge too. What if I can't get on the internet and that kind of thing? And, with my own parents in town, we've had some internet challenges here and there on how to use things like email and shopping online. So it shouldn't be a surprise to anyone that, online can't be the only way we're doing this. So we are doing this now through 311, through our senior affairs department. So again, if you're over 60 and you don't have access to the internet, can't figure out how to register, just call 311 and we'll try and help you out with that. Couple of other things to mention that really our counselor is going to dive into, but we want to make sure that, regardless of things like immigration status, et cetera, you are eligible for the vaccine, and taking the vaccine does not affect status for folks. And these are just two different categories. Public health has always been something that is about the public that's living here, regardless of your background or your paperwork. So to tell her own story about the vaccine, Councilor Lansena.
Thank you for that, Mayor Keller. Again, I'm City Councilor Lansena. I wanted to speak to our refugee and immigrant community on how important it is to sign up to get vaccinated. It's important to keep our community safe, as well as doing our part in washing our hands, keeping 6 feet apart, and wearing our masks. Now, hope has arrived to get to our community out of this pandemic through our vaccines. It is essential that we continue to do our part and sign up to get vaccinated and go to your appointment when you are informed of your vaccination date. When signing up, the data and information is safe and secure. Your health and personal information are kept safe and will not be used for any other purpose than getting you vaccinated. You will also not be charged for the vaccine. And as the mayor stated, regardless of your immigration status, it is important for you to get vaccinated. I know and understand the reservation that our community have, but when I made the decision to sign up to get vaccinated, I first consulted with my cancer doctor. As many of you know, I have a pre-existing condition of battling cancer for the last 10 years. I am currently undergoing chemotherapy for a type of blood cancer, and when I discussed getting vaccinated with my doctor, he stressed the importance and community benefit of getting vaccinated to keep myself, my family, and my community safe. I signed up to get vaccinated as well as many of my family members and elders did. When I got the call more recently to get vaccinated, I made sure to go. The vaccination was quick, and I was grateful to be surrounded by healthcare professionals at the vaccination site to make sure I felt comfortable and safe. Many of these healthcare professionals are from our community, our pharmacists, our school nurses, and our family members. After getting vaccinated, I felt great and hopeful, knowing that I'm doing what I can to keep my community and elders safe, as well as helping our hospitals and healthcare providers. Be sure to sign up to get yourself vaccinated, and when you're informed that you have an appointment to get vaccinated, to please go. Thank you, and I'll turn it back to Mayor Keller.
Thanks so much, Councilor Sena, and really appreciate you sharing that message and your own courage with what you're going through, and for being willing to share it with the rest of us. And I would also just mention that for everyone, if you are concerned about any of those issues and these kinds of things coming up, you can start by calling 311, and of course there is Spanish language available there, and also our Office of Civil Rights, which can also provide information through a number of different languages. Okay. Now let's talk a little bit more about vaccinating with respect to a little different slice of the population in terms of our seniors. And the city is partnering with Lovelace on a program called the PACE program. And this program is really about taking care of our most vulnerable seniors. And I want to introduce Dr. Vesta Sandoval, the Chief Medical Officer for Lovelace, to walk us through this great program. Doctor? Doctor, unfortunately, you're muted, as is, how Zoom is and all. Thanks.
All right, sorry about that. I got off talking. Thank you, Mayor Keller, for asking us to come and talk about this great program. We were very excited to participate. Having worked with PACE in the past, we knew that they were representing a lot of very vulnerable, fragile, older citizens from our state. And what we wanted to do is to be able to find a way to vaccinate that particular population fairly quickly so that we knew that they were protected. We partnered with the city and with the Department of Health, and I can't say enough about how much they've done as far as having structure, people that are knowledgeable, and having the processes set up so that they run smoothly. So it's just been a fantastic partnership. And we worked with the administrative director of PACE as well as their physicians to be able to set up a list of patients that would be qualified to receive the vaccine. Our teams consisted of our quality team, as well as the CEO of our Westside Hospital and our CNO from the downtown facility, Nancy Cole and Amy Blazing. And again, it was just a great opportunity for our volunteers to go in and help give the vaccine, work with the city side by side. And it was very, very fulfilling. It was a very positive experience. Our staff was very excited, and it was really nice to see how thankful the patients were that they were receiving the shots. And over time, we were able to do 150 at the local Longfellow Elementary School and 50 more at the Westside Hospital. And the second round of shots will be scheduled in appropriate time frame. But again, it has been just a very, very exciting and fulfilling experience to be involved. And we plan to do further work with the city and Department of Health with specialized populations to continue to try and reach those populations as quickly as we can, since we all know that vaccination is exceptionally important to keep our state healthy. So with that, back to you, Mayor Keller. Thank you.
Thanks so much, Doctor, and Lovelace and the PACE, all the folks involved in the PACE program. We really appreciate this work, and glad we can continue this partnership to help vaccinate some of our most vulnerable. I think I would just also, just thank you for all your work as a medical professional in our town. And some of the stats that I shared earlier, they're a reflection of the good work of all of our healthcare providers, including yourself and Lovelace, and of course, all the other UNMH and Presbyterian and Optum and our others. So we're glad in Albuquerque to be the home of, all of our major most of our major healthcare providers for the state. Now, let's talk just briefly about a little bit different topic, but we want to make sure and let folks know. We are, during the pandemic, still continuing to hire for a lot of our summer programs. And you'll recall last summer, we were able to take care of about 10,000 kids over the summer. Now, this summer, we're preparing to do the same, but we need to hire workers, and it's a lot more complicated because of COVID, but we did it last year, and so we're going to do it again this year. And so typically we hire 1,000 teenagers. And in fact, back in the day, I worked a little bit for one of our city programs myself growing up here. And so this is a great tradition in our city, but it is happening in February. It's hard to believe, but the lead time, especially with COVID, that we need to do this is we basically have to get everyone kind of signed up and registered in February so we can go through the different processes to get them ready to go for the summer. So our youth job fair is taking place, but of course it's virtual. But it's February 6th and it's 10 a.m. to 2 p.m. And we're going to be we do basically, the way this works is we do live interviews on the spot and seminars and so forth. And so to get info and to schedule an interview, that's probably the most important thing. It's cabq.gov/job fair. And again, that's about 1,000 of our youth. That it's a great program that I know many of them cherish. And of course, they end up taking care of like middle schoolers and elementary schoolers through these programs. So it's a really cool thing, and we're going to need it again this summer. And again, that program was handled in a COVID safe way last summer, so we're well prepared to do that this summer. Okay, with that, let's talk about some of the efforts we have done and with many, many nonprofits in our community. And we have a little bit of an annual report that we want to share with you briefly here, but it's just a good reminder of the hundreds of nonprofits that are doing good things in our community every day, including with respect to COVID response. And in total, it might surprise some folks to know that the city spends about $64 million with nonprofits right here in our community. There's about 250 local nonprofits and social enterprise organizations that are detailed in this report. This does make the city the single largest funder by far of nonprofits in our community. And we historically actually have never had a one-stop shop that highlights all of this and all of the great work that these nonprofit folks are doing. But now, fortunately, we do. And that's what we're sharing with you. And the woman who's put this together and is in charge of our nonprofit partnerships in terms of coordination at the city is with us today. So I'm going to hand it over to Mariah Harrison to walk us through this.
Thank you very much, Mayor, and thank you everybody for joining us today. I do appreciate the time to share this report. It is really something to celebrate. Those numbers of the organizations that we've worked with is over 250. And in the fiscal year 20, we were working with over $64 million for those contracts. So I'm going to share my screen here briefly and go over a couple of the highlights. So bear with me while I set that up. So again, I'm in a really celebratory mood when I talk about this. And so I hope that you'll find it useful also. This website, the report is available on the website. And I will share the link with you at any request. It's under the Civic Engagement Annual Report page. So I'll remove my notes here, and I hope that you can see what I see. There we go. So it's about 32 pages, and it's broken up into 3 major sets. The first, of course, is our intro, and you'll see the table of contents is actually pretty extensive. The first part of the report itself goes into actually our COVID relief funding. And so I do want to make a note about that. This is separate from the contracts that we work with over those $64 million that I mentioned. But given the year that we've been in, we wanted to be sure that this report reflected partnerships through the COVID funding and relief work that was done over the course of the year with nonprofits. So there's a bit about that and the number of different departments that were given some money to work with through CARES and through general funds for these organizations. So there's a lot of really wonderful highlights there. Family and Community Services provided over $1 million. And then of course, Cultural Services had a large chunk there. And then we had some very specific programs and partnerships. The first one you might remember when we were providing some shelter for people experiencing homelessness, they were able to provide the West Side Emergency Housing Center with a lot of beds, 24 hours worth of support, 3 meals a day. And then of course, in addition to that, because of the number of people needing quarantine, there were some wellness hotels set up, and there was a number of locations for those. The next project I want to point out is the Albuquerque Community Fund. You might remember in December, over $2.5 million was provided actually for over 1,200 families that were not able to take advantage of federal relief earlier in the year. Then over a number of different weeks, while the Economic Development Department was providing grants to small businesses, there was also PPE provided to over 2,000 small businesses. And these are, of course, organizations with 50 or less employees. So those were some very unique and very impactful COVID funding programs that we worked with for nonprofits. The next part of the report is broken up through departments. And the very first highlight is Family and Community Services, as you'll notice, with over $52 million and 78 organizations that were able to take advantage of these contract opportunities. Along through the report, most of the departments have project highlights. So we gave some specific time to organizations or projects that the department wanted to make a point of noting. And for example, Family and Community Services project first highlight is the Albuquerque Street Connect program. And that is where there's a number of different organizations partnering with Heading Home who are addressing behavioral health issues in our downtown area. And as the report notices, over 120 clients were able to receive support through that. On to Cultural Services, and then we have a couple of other project highlights. And then Economic Development is another one of our really incredible highlights here, over $7 million with over 40 organizations. I want to make a note that while I was working with the department, I learned that over 75% of the contracts that Economic Development does is through nonprofit organizations here in town. And there's for a lot of purposes, you know, workforce development, trade, and we also are working with the chambers for things like that too. So I'll skip down a bit further so that you can see just sort of the various discussions that we have here. Every department got some sort of attention to, at any rate, you'll see that even environmental health might have only have noted something about over $27,000 worth of one contract, but then we uniquely pull out the work that they're doing with Prosperity Works for the American Cities Climate Challenge as their project highlight. And that's some incredible work too. So at all ranges of contract numbers, of organizational partners, of contract funding, the department, the report reflects the department breadth of these relationships and the impact of its work. The legal office, working with specifically the Office of Policy, is a contract that I want to point out here through the New Mexico Dream Team, where people can take advantage of their program called Financial Navigators. This is for individuals that are still experiencing stress financially, and throughout their families, whatever the need may be. The Financial Navigators program can provide some relief through referrals through local organizations, and also financial assistance, not necessarily providing any funding, but providing guidance through experiencing these financial hardships. So 2 more points that I'm going to make. The Albuquerque Fund, one Albuquerque Fund that was established through Mayor Keller, has raised over $500,000 since its inception, and I think more since I've actually been able to publish this. And over $226,000 was put out towards COVID relief programming. So make a note there that that's another way to support city initiatives through the One Albuquerque Fund directly. The last bit of this is ways to partner. We wanted to be sure that organizations know that they can reach out to our city departments to find ways to receive these contracts. These are fees for services. You know, there's cultural events going on. There's educational, and there's more support for social and small businesses to be had through many of our departments. And then the last bit is a really great list of 250 or so organizations that the city is working with, and of course a bit of gratitude as well. So I think that's a good highlight, and I'll stop sharing and turn it over to Mayor Keller. Thank you.
Thanks so much, Mariah, and great reflection of just a lot of good work, and great to see it all in one place as well. So folks can see that on our website, of course, and look up those various details and so forth. And so we appreciate all those 250 nonprofits, and all the nonprofits in our city, but our 250 partners who are helping get those tax dollars to the folks in need that they can do in a better, more efficient way than the city doing it directly, is why we obviously use nonprofits to help with this. So with that, let's wrap things up, and we'll take some Q&A here. And let me, I think, just close by reminding folks that in our city and in our state, we're very much still right now dealing with the long legacy of just a very unfortunate federal response last year to the pandemic. And now we're seeing it with this very lumpy vaccine batch distribution, even for our state. But we are optimistic that that's going to, eventually work itself out. And especially, I think, with the new approach that the new administration's taking. I think it's also a good reminder too that, there's no sort of blunt singular tool that obviously can fix a lot of the challenges, whether it's at our city or in some of our departments. But really, from day one, we've said we've got to carve our own path in Albuquerque and tailor that COVID response to the unique needs of our city and our hardworking families and small business owners. So we will continue to do that. And also, I think it's important to remember our city continues to demonstrate to the rest of the West, at least in terms of what we track, we are a healthier, better place to live in a pandemic, despite all the challenges we do have in our town. And that's a good thing. It makes me grateful to live here and proud of our city. So with that, we'll open it up to some questions from folks. And I think today we don't see a lot of questions coming in. So we'll give folks a few more seconds, and then otherwise we will just wrap it up here. And again, we hope to be back next week to talk about going to yellow. we'll wait and see. All right. Okay. With that, we'll say good